So in this session here, this is really an evaluation of the impact of CwPAMS and the Global Health Fellowship on pharmacy professionals. And at the induction, a few of the fellows, I want to say volunteered, but I think there was a mixed approach. But somehow, they're all laughing, 4 of them took on working with CPA to evaluate the impact of the CwPAMS and the Global Health Fellowship on pharmacy professionals. And it's Claire Brandish, Kate Russell-Hobbs, B. Yearlong, and Fran Garrigan. And what they'll do is they'll introduce themselves very briefly, but in this session what will happen is that I will start off just to provide the introduction and the methodology that we took, and then each of the fellows have taken parts of the evaluation and led on its analysis and the presentation. The development of the methodology, particularly the post-fellowship questionnaire and the other surveys which they will talk about, was very much a joint approach, and CPA led fully on the pre-fellowship assessment, obviously because they hadn't started their fellowship at that stage. So if I get started. So again, the aim here is to evaluate the impact and to consider if there are any benefits to the NHS. And the methodology, the method that we took were to use questionnaires to develop and assess the leadership skills, impact and benefits over the last 12 months. We used a mixture of structured and non-structured questions, and we used the SurveyMonkey as a way to get those questions. One thing to highlight is that both the pre and post fellowship questionnaires used was based on the validated MoveIt tool, which was developed as part of the Global HEE Global Health Program led by colleagues in the Change Exchange. So there's a behavioral aspects in terms of parts of the questions we've used, but we also used the RPS faculty peer assessment tool and the NHS healthcare leadership model to develop the another questionnaire, which is where we asked for feedback from senior colleagues and line managers of the fellows to assess and compare their leadership skills over the past year. We also then went out to the pharmacy participants who were not part of the fellowship to ask and to get their views on of the impact of the global health work on project on them. Data was extracted and it was anonymized before it was passed on to my fellowship colleagues to analyze. So really they had no idea what the data was or who it was from, because we had at CPA's level removed all identifiable data. In terms of the demographics from the CwPAMS, so the pharmacists that were not part of the fellowship, we had responses from 7 colleagues. And if any of them are online and would like to still contribute at a later stage, please do so. It's really important data for us. And the fellows will be writing this up as a peer review publication. As peer review publications. And then for the fellows, all 16 of them responded to the questionnaires. And as you can see, there we have 3 males and 13. And in terms of years of registration as pharmacists, you can see that it's very similar, both within the average or the mean was similar for both those who were part of the fellowship and those that were not. And it's about 13 for those who were not fellows and 15 for the fellows. And the range, again, very similar. And we had a majority of the colleagues were from hospital, acute trust for the fellows, but we had representation from community as well for that. Whereas we had there was no community within the other pharmacists who were not fellows. And finally, in terms of global health experience, none of the pharmacists who participated and were not fellows had a global health experience before, but 5 of the fellows had done. I'm now going to hand over to Claire, who's going to go through the results. So they'll basically introduce themselves as they go through this, and then they will share their benefits of the fellowship to them at the end. And just to say that, as we know, they all participated in projects within Uganda. So if you want to find out more about their particular projects, those are available through the posters which are in the Google folder. Over to you, Claire.
Thank you, Diane. I'm Claire Brandish. I'm the lead antimicrobial pharmacist at Buckinghamshire Healthcare Trust. and I'm going to be focusing on the results of the questionnaire sent to pharmacy staff involved in the CwPAMS programme who were not enrolled on the Chief Pharmaceutical Officer's Global Health Fellowship. So this questionnaire involved 28 questions to understand what, if any, impact participation in a global health project such as CwPAMS could have on pharmacy staff. So these questions were themed around antimicrobial stewardship in a low to middle income country, whether they perceived volunteering to be worthwhile, and if these experiences had influenced any changes either on a personal or organisational level. Sorry, Diane, previous slide. The answers from all the open-ended questions were used to create a word cloud. So the larger the word indicates more frequent use. And there's a real breadth of words here, but keywords include antimicrobial, educational, skills, challenges, professional leadership, awareness, global, personal, and resilience. And these really encapsulate one of the main aims of the CwPAMS programme, to develop leadership skills of pharmacy staff with a focus on antimicrobial stewardship in a global context, and suggest that these have been achieved through these unique experiences. Next slide, please, Diane. So it was hoped that a comparison of responses to the questionnaires would allow a more comprehensive evaluation of the fellowship to see if there were any differences and additional advantages in undertaking the fellowship alongside a global health project. Unfortunately, only 8 out of the 20 CwPAM participants responded in comparison with all the global health fellows, but this was a compulsory element of the fellowship, so may just reflect that. Here, participants were asked to reflect over the last 12 months and respond to Likert rated statements, so whether they strongly agreed, somewhat agreed, were neutral, somewhat disagreed, or strongly disagreed with the statement. Because of the difference in response rate. And also, as Diane pointed out in the demographics, they were well matched with the exception of global health experience in a third of the global health fellow group compared to none in the CwPAMS group. Other previous experience, job roles, response to the coronavirus pandemic are also likely to impact on the results of this. However, from the data available, it appears that the majority of both groups agreed with positive developments in terms of changes to practice, improvements in service, self-development, or approach to new experiences. We know that staff well-being and happiness can result in organisational gains such as staff progression and retention, but also impact positively on patient care. Next slide, please, Diane. So in response to the direct question of whether they believed there were benefits to the NHS from the CwPAMS programme, only 4 out of 8 of the CwPAMS actually responded to this. However, all gave examples of how benefits had been achieved for the NHS. So the qualitative data shown here provides some real valuable insights and examples of how pharmacy staff and the NHS have benefited. One pharmacist believed that those who'd volunteered demonstrated leadership skills and resilience during the COVID pandemic. Specific examples include a better relationship with the infection prevention and control teams and promotion of antimicrobial stewardship on elderly care wards. A powerful quote from another pharmacist explained that volunteering has not only given me the experience of a lifetime, but it's developed my leadership skills in ways I don't think I would have achieved quickly in my day-to-day job or on any leadership course. It has made me more resilient and flexible in new ways of working. This is the first time that pharmacy staff have been specifically included in a global health programme, and it indicates that additional opportunities and development can be gained by experienced pharmacy staff, making more rounded individuals and harnessing the power of collaborative efforts. I'm now going to pass on to Kate Russell-Hobbs.
Hello, I'm Kate. I'm an infectious diseases pharmacist from Buckinghamshire Healthcare NHS Trust, and my part of the fellowship project was to look at what we have gained as fellows the most. Thank you very, very much to all the fellows for their 100% response rate to the questionnaires. we were given 2 questionnaires, one pre the fellowship and one post the fellowship. And the results that follow are just a snapshot of the data generated from those questionnaires. And just these are interim results, and the full results will be available in the subsequent manuscript. So the graphs that I'm about to show you are as a response to the question, what do you hope to gain the most from your fellowship year? Or what do you think you have gained? Diane, can you show the first graph? Yes, so these are just a snapshot, 3 areas of where we've made the most improvement as fellows. So we've gained in greater understanding of international development and health partnership principles. We've gained in understanding of pharmacy skills within global health. And we've gained a greater understanding of AMS in low middle income country context. But I think the quote at the top reflects definitely how we feel, that I could have ticked every box. I've been exposed to so many opportunities. And I think that really sums up the fellowship, is just how many opportunities we've been exposed to. Another quote that I felt that resonated with us was confidence in new situations. Okay. So this slide is a word cloud generated from the answers to the question. I felt the fellowship has been worthwhile or not worthwhile because, now again, you can pick out the words fellowship, opportunity, colleagues, worthwhile, health, and it's been overwhelmingly felt to be worthwhile, the fellowship. And to use the quote, it has introduced me to some amazing people I would not otherwise have met or had the opportunity to get to know. In addition, there are lots of themes pulled out from the answers to this question. Opportunity to make a difference in my partnership country, develop links with other like-minded pharmacists nationally, develop leadership skills, learn new skills to apply in personal life and professional life, develop links with a hospital in the low to middle income country, and leads to more exposure to global health. In addition, I just wanted to mention that the support given by Fleur and Diane was also specifically mentioned by some of the fellows. Next slide, please, Diane. And would we do it again? So this slide is the graph is in response to the question. Generally, I felt the experience of participating in a global health fellowship was overwhelmingly positive. There was a new category added by 2 of the fellows, which was very, very positive. And those pictures around the graph, they're all from our fellowship WhatsApp group, which has been very active in supporting each other. And it just goes to show the breadth of communication, what we've all been up to over the last year. And this quote, I picked out, I would strongly encourage others to undertake similar opportunities if given the chance. And I would like to just add that other pharmacists not involved in this project are now asking us personally about the fellowship. So I think it's something that we've all gained from, and this is the results of that information. And I'd like to hand over to Bea.
Thank you very much, Kate. Good afternoon, my name is Bea. I'm one of the antimicrobial pharmacists from Buckinghamshire Healthcare. So this section is focused on the result of the questionnaire completed by the fellows' senior colleagues. So approaching to the end of the fellowships, each of the fellows were asked to identify at least 2 senior colleagues who have known them for at least 1 year to complete the anonymous online pre- and post-fellowships questionnaire. So the senior colleagues were asked to rank the fellows' leadership skill using a scoring system ranging from 0, unable to comment, to 4, exceptional. So the aim is to get an insight of other people's perspective of our fellow leadership skill. So by the end of the data collections period, we received 25 feedback responses for 14 fellows. We have to exclude 5 data sets because of incomplete data. And there were 9 fellows who received at least 2 responses each. So if you look at the slide, the graph illustrates the average level of competency for each leadership dimension. I think it's quite self-explanatory that there was an overall improvement in all the dimensions. And the dimension that demonstrate the most changes and improvement is the managing changes dimensions and innovative working and practice dimensions. All of this has echoed the qualitative data, which I'm going to talk about on the next slide. Next slide, please, Diane. Thank you. So for the qualitative data, I used the theme analysis and the word cloud to identify the keywords and common themes from the questionnaire. So if you look at the word cloud on the slide, you can, the number of times a word is mentioned is correlate with the font size. You can see the words that mentioned the most is leadership, confidence, opportunity, and network. So there's also feedback from the questionnaire that's about some of our fellows who embrace the behavior change approach and apply it to various areas such as education and training. And also there's a lot of mention about utilize of quality improvement methodology to identify the area of improvement in their service. One of the common themes that actually identify from this questionnaire is the unprecedented COVID-19 pandemic, which require all NHS staff to work differently under a very highly pressured environment. So many of the senior comments that the fellows have adapted very well to the changing situations and have worked effectively while maintaining a calm through social media and also network to disseminate informations. So I believe this is one of the main reasons that contribute to the improvement in the managing changes and working innovatively dimensions. Can you move on to the next slide? Thank you. So when we ask the questions, whether the seniors think the fellows are ready for more senior roles, 100%, which is 25 of them say yes. And when asked whether they will recommend the fellowships to others, 22 of them say yes, and 3 of them say they're unsure. So I think this indicates that the majority of the respondents see the benefits of the fellowships. And if you see off the slide, it's just some of the comments I pull out from the questionnaire. And it's been a pleasure. It's quite nice to read on. So please feel free to have a read. But thank you very much. I hope I've been bored you. I'll hand over to my next colleague, Franz. Thank you.
Hi, everybody. My name's Fran Garrigan. I'm lead pharmacist for Antimicrobial Stewardship at Manchester University NHS Foundation Trust. My section of the project is to highlight some of the benefits of the fellowship back to the NHS. And it was highlighted today by Jed Byrne and Keith Ridge earlier that we know that global health does bring benefits back to the NHS. NHS staff being involved in work in low and middle income countries does benefit the NHS when they come back to work. So what has our Global Health Fellowship brought back to the NHS? This table shows us 5 main topics, and I'm just going to pick on 2 of the topics in particular. The first one is really the experience of working in resource limited settings. This is really useful in working in today's NHS. One of the main things that's important is the understanding of frugal innovation. And our fellows have come back to the NHS with the understanding that improvements don't always require money. And in our ever-changing NHS that is under a lot of pressure, this is a really useful thing to be able to understand and adapt to our working environment. It prepared us to expect the unexpected. There's been quite a lot of talk about COVID-19 today, but really it has made us as fellows more adaptable in our day-to-day jobs, and we've been able to put that into practice in the initial COVID-19 response. As pharmacists, we're very used to dealing with drug shortages, and our projects have actually shown us how to consider alternative approaches and also to appreciate the supply problems that we have in the UK are relatively insignificant compared to our partners. And when faced with the prospect of no alcohol hand gel during COVID-19 in the UK, the attitude of some of our fellows wasn't one of despair. It was more, right, how do our partners do this? Let's get on with it and make it ourselves, which is a really positive way to adapt to our surroundings. The NHS has benefited from the development of leaders in the fellowship. Our initial training on the fellowship induction involved rigorous coaching and leadership. And one of the quotes from the fellows was that the coaching was invaluable. We were able to practice our communication and negotiation skills in a safe environment. And we were able to practice difficult conversations, which at the time was terrifying. But I know many of us have taken this skill back to our own environments. Personally, I know these 2 days have changed my management style, and it's significantly improved some of my working relationships. We've all developed an experience of behaviour change and in our approach to education and training, and also developed our networks and a real understanding of how we can work, how to work in low and middle income countries. Next slide, please, Diane. So this slide shows many of the other achievements that our fellows have achieved through the fellowship year, sort of outside of the CwPAMS project. And it's a wide range of activities, as you can see, and these span beyond the breadth of the fellowship. We've collated this information during the year based on a lot of the WhatsApp messages we've seen, a lot of the social media, and it's really great to see all the different things that our fellows have achieved. Journal publications, conferences, a wide range of well-renowned conferences, increased work with the Commonwealth Pharmacists Association, involvement in research and behaviour change techniques with antimicrobial stewardship, gone on to academic teaching, and we've opened up opportunities within our own trusts, presenting to trust boards, which isn't something that really in most of the positions of our pharmacists would have done. Pharmacists have got out there and really publicised the fellowship and the CwPAMS projects through podcasts and radio and blogs and community engagement. And it's important to realise this is just the beginning, and these activities are continuing past this. Even today, while this meeting's been going on, there's been things mentioned on the WhatsApp group that other people are still doing. It's evident that the fellows are branching out and are trying to be included in more networks and involved in wider national campaigns way beyond the breadth of the fellowship. Next slide, please, Diane. And moving on from here, it's amazing to see the growth of our fellows and our CwPAMS projects on social media. And here's just some of the highlights of our projects on social media. Social media has enabled us to spread the global health messages, and it's broadened the scope of people who are aware of global health. It's inspired fellows to undertake additional activities, and it's enabled us as a group of fellows to share good practice and also share materials with each other. It's meant that our projects aren't working in isolation, and it's ensured that we can support each other from afar, and we've developed a real camaraderie with each other. We've also developed the skills of our fellows in social media, and through the involvement in social media and the experience, it's led to fellows setting up their own professional networks and communication strategies within their own trusts. However, we do know that social media is relatively new. It's a relatively new way of working, and it doesn't suit everybody's style. But this slide just really demonstrates some of the positive aspects of social media, and there's a lot going on today as well just during this session. There's a lot of Twitter activity today, so have a look on social media today. Last slide, please, Diane. So what has the fellowship meant to me? It's pushed myself far outside my usual boundaries, and it's enabled me to work with some inspirational teams, members of my fellowship team and also my CwPAMS team. I've been able to work with Health Education England colleagues in my CwPAMS team and behaviour change colleagues, health psychologists, and also the amazing fellows that we've worked with. And Diana and Fleur, we've learnt such a lot from them. It's really developed my confidence and resilience and has motivated me at work, and most importantly, has made me believe in myself. I've developed the powerful art of reflection, which I do incorporate into my daily life, and it's made me realise I'm not just a pharmacist, I am a pharmacist, and I am proud to be a pharmacist. Thank you very much. I will hand back over to Kate.
Thank you, Fran. So what has the fellowship meant to me? I'm an infectious diseases pharmacist, and I have been a pharmacist in the NHS for 15 years. And this is the first real opportunity I've had to use my pharmacy skills in another country. I also hold some of the fellows responsible for me currently undertaking a master's in infectious diseases at the London School of Hygiene and Tropical Medicine. I was at very much a crossroads in whether I should do this or not. And when I went to the first fellowship event, Diane and Edwin in particular encouraged me to continue with my studies. The fellowship as a whole and as part of the CwPAMS project has given me a real chance to feel that I've made a difference. It's definitely improved my leadership skills and hugely improved my job satisfaction. It's also been a key chance to be part of a group with similar interests. But personally, I was going through a bit of a change. So I have a 2-year-old daughter, and I didn't know if I should do this. But it's made me realise that it's okay to be a mother and also to be ambitious with my career. And I just want to say that it's been the best year of my professional life. It's been an honour and a privilege to take part in such a project and a fellowship. And without the support of key people, I wouldn't be here today. So I just want to say thank you very much to our Chief Pharmacist, Jane Ballinger, who without her support, we would not be here, and our Medical Director, Dr. Tina Kenny, in addition to all of our Ugandan partners and all of the partners at Nottingham Trent University. I'd like to hand over to Bea.
Thank you very much, Kate. Cool. So when asked what does the fellowship mean to me, I have to honestly say there was time that I feel overwhelmed, want to cry, but did not cry. And what have I done to myself? But what I've gained in return have outweighed that. As a pharmacist with less than 5 years of experience, the opportunity to work on a global health project is invaluable. Even though as a Malaysian, I have experienced a healthcare system in another country as a patient, but seeing the healthcare system in Uganda as a healthcare professional has opened my eyes. I was amazed by what has been achieved with their enthusiasms, even though there are limited resources. And through the fellowships, I have the opportunity to receive leadership training, which I've never exposed to before. And one thing I learned is the power of mentorships. There was a saying that mentorships is not about being the authority, but it's about elevating others, which is exactly what I've got, not only from my mentor from the fellowships, but also from Diane, from other fellows, and my chief pharmacist, Jane Ballinger, who have always encouraged us to think. Also, I'm very grateful to be able to work with so many amazing people. For example, within our organization, Dr. Jean Ostrisko, from our Ugandan partner, Dr. Jodie Winter, Dr. David Musoki, Dr. Freddie Kichitu from Uganda, and I can spend hours just listing names, but we don't have time for that. So looking back to the past 18 months, I still can't believe the amount of work all the fellows have achieved. And we are coming to the end of our project and fellowships. One last thing I want to say is, if I could do it all over again, I would do it without a second thought. Thank you very much. I'll hand over to Claire. Thank you very much.
Thank you, Bea. So we were all tasked with providing a single slide to capture the impact of the last 18 months on ourselves, and this is mine. I'm not going to apologise for how busy this slide is, because I think it's a true reflection of how my synapses have literally been on fire, and how my mind has just been open to so much growth and opportunity, and I've been inspired by so many people. As everyone said, it's been the steepest learning curve with lots of work, but it's given me a newfound enthusiasm for professional development and a passion for global health. In the beginning, I sort of put this into 4 categories, but actually the truth of it is that a lot of this overlaps. Buckinghamshire Healthcare Trust were welcomed into a 10-year strong health partnership between Nottingham Trent University and Macquarie University. And it's through this healthy attitude of cooperation and not competition that we've learned so much and had the privilege of witnessing true leadership in action. Our project was focused on a One Health approach, which required us to reach into the communities in Wikizo, Uganda, to provide sustainable solutions. And this has given us new confidence to reach into the communities of Buckinghamshire and the networks within the UK. The greatest changes for me have been on a very personal level. The positivity that I've experienced and the can-do attitude is infectious, and I've been very fortunate to meet so many people like this. One community health worker said simply, "When you love something, you do not see the challenges," and this has resonated with me and my feelings for the NHS. Diane herself has been truly inspirational and has encouraged all of us to say yes even when we're scared, and that's why we're sitting here now. Professionally, I've been pushed out of my comfort zone and beyond to do things I would never have dreamt of. I've presented at the Royal Pharmaceutical Society Conference, UK CPN, involved in more community projects at home as well. It's been wonderful to hear about the successes of people working towards the same goal in sometimes very difficult situations, and it really makes you realise that we can all do just a little bit more. I'll hand you back to Diane now. Thank you.
Oh my goodness. I was in tears through that. And I know my other CPA colleagues were as well. I spotted that. Thank you so much to all the fellows. I didn't write a speech for this part, but I'm in awe. I have absolute respect. And this is very personal for me. I think I just put into one of the groups, you know, how I'm lost for words. So I'm going to stop talking. Emma, I need your help. And it's not very easy to get me to be lost for words.
Okay, well, I just wanted to say how impressive it is, the range of different projects that have been done, the huge amount of work have been done, the huge networks that have been built up. And it's especially unbelievable to realise that all of this work has been done within a year, which it's so impressive. It's such a challenge to set up big projects like this, particularly when you have to get used to groups of people you've never met before, coming from different cultures, and you have to get to know each other and understand each other's ways of working. To pull these projects together in just a year, meanwhile doing all this additional work for the fellowship, is truly amazing. You've done a spectacular job, and yeah, you should all be really, really proud of yourselves.
One thing I want to highlight is to just specifically call out and thank the Chief Pharmacist for the Buckinghamshire Trust. Allowing 3 of your staff to go on a project like this was brave, and I hope you are truly reaping the benefits. And to all the Chief Pharmacists as well who have supported, and colleagues who have supported the fellows, thank you.